Welcome back, everyone. We are in our last session of the 6 weeks skill CHSE preps course. Hello, Irene and Krista. Hope you and your families are doing well. Just want to we're starting off today with, we're in our final session, which is 12% of our CHSE test plan, simulation resources, and environment. Dr. Sellers Educate is approved as a provider of nursing continuing professional development by the North Carolina Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. To receive contact hours, you're required to stay for the entire program, watch the full recording, and complete the evaluation. So I hope everybody's doing well. The weather is getting colder here, and I hope we're trying to stay warm, which we are staying warm on this side, and I hope the same for you and your families. And I hope everybody's doing really well. Irene, I hope your son is doing better.
Hi, he's good, but my daughter's now sick.
Oh, Irene.
I'm sorry. She fell and she has bruised her whole eye and her cheekbone,
Oh, wow.
and she's congested, so it's been a rough week.
Rough week. Well, thank you so much for pressing in this afternoon. Again, you can email me if we need to do something again, when everything levels out with you and your family. I don't mind doing that. So thank you
Okay,
again
thank you.
for pressing in, Irene. Okay. Everybody else doing good. Krista, how are you doing today?
I'm doing good. Just getting out of the office late today, so I'm gonna switch over from my cell phone to the laptop once I get home and once we get our first break. But
Okay.
it has been a lot. It's been busy.
Uh-huh. Yes, 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 yes. I think everything in the fall, it's kind of slow down, but still there's a nice steady pace here as well. Well, you be safe, okay? And we will wait to chat more with you once we get you in home and settled in after the break. So thank you also for pressing in. We appreciate that.
Of course, happy to be here on our last one already.
Can you believe it went by so fast? I'm like, oh my
It
God.
has.
It has gone by so fast. It really, really has. Yes, yes, yes. Well, tonight is a little different. I think it's a little bit different than the other nights, but I'm gonna review some CHSE exam logistics. We're gonna go to the SSH website and just review a few of those logistics again, just about taking the exam. We did it at our first session. We'll do it again tonight. And then we have two quizzes, 12% of the test plan sessions, operation and management, environment, personnel, non-personnel resources. Chapter 23, accreditation of simulation labs and simulation standards. A lot of this has kind of been integrated throughout our other chapters as well. So you might see some repeat and it might feel like a review for you as well. However, there are NASCO standards that really speak to the operational side of the SIM Center. And there's also a nice section in the Pallegana's book, the Maxwell Pallegana's book, that speaks to operations as well. It's 12%, but um, don't look at that as, oh my goodness, I won't spend a lot of time, because every question matters. Every question matters, except for there are a few that they have on there as test questions. So we don't want to just minimize our intentionality with this section as well, simulation resources and environments. And once we finish that, we'll take our first break. And then when we come back from our first break, you will have the opportunity to do questions 1 through 25. There's about 150 questions, I think, in this cumulative exam in the back, which really I'm glad is more questions, because that will give you extra questions that you can actually take as well, even after our time together. And I hope that you will do that. If there's any questions that you should have, you still will have access to emailing me. And we can also, I am open to meeting with you as well. And we can do a few test questions if you like, or just if you want to conversate over some content, that would be great as well. I do recommend, if you haven't taken the self-eval that's put out by SSH, I do encourage you strongly. It was very helpful. I did it at the beginning of my study time of prepping for the CHSE exam. It's very, very helpful because it also will help you identify those gaps. That's what our course is designed to do as well. But completing that at the beginning of the course is critical. And most participants, usually they'll email it to me, and I'm able to give some feedback. And that feedback is usually personalized because I'll usually have a website, a Zoom session with you, and we just go through your worksheet. So I do encourage you, if you haven't done that, I didn't receive any from this cohort, but I encourage you to do that. There is some value in that self-evaluation and just being able to go through each of the test plan sections. There are a lot of good questions in there. And one of the review sheets, self-evaluation sheet, encourage you to flip those bullet points into questions. And you should be able to talk in a very, very healthy way about each one of those sections, not just one sentence about it. And so the areas where I had just one sentence or I struggled and could not talk about it, again, I took a deep dive into my Maxwell Pallegana's book. And the NASCO standards was very, very helpful in really, really going through each standard and making sure I understood and was able to see that standard in action. That was very, very helpful again. So we'll take the quiz tonight in the back of the book. We will hope to do questions 1 through 25. Give you about a minute or two per question, probably about just a minute. That's a nice little pace. And so I'll give you 25 minutes to take those first 25 questions in our test in the back of our book. Then I'll give you a break, and then we'll come back and finish off our session going through each one of those questions, as many as we can. And then we'll wrap it up with the program evaluation and your next steps. So that's our agenda for tonight. Let's go ahead and look at the SSH website. When you go to the SSH website, we looked at this before, but just kind of wanted to highlight just a few things. Your eligibility, which all of you are eligible to sit for the CHSE exam. There are some requirements for you to be able to sit for the exam, and each one of you qualify for your sitting of the exam. I don't encourage you to wait too long. If you should have identified some areas that you may say, I need a little bit more, I need to take a little bit deeper dive, I do encourage you to do that. The commitment is about 1 to 2 hours a day, that you really get very intentional in going through the sections, questions, and your Maxwell Pallegana's book, and being very intentional taking those questions. Even questions that you can actually do when you're sitting in the home. Sometimes you're waiting. At school, we probably don't always have a lot of downtime, but riding in the car and someone else is driving, that's a good time to really do a lot of those questions. So when you go to submit your exam, you will log on to the SSH website. And these are a lot of the things that go along for your application, a verification of eligibility, which will answer those questions, your demographic section, your membership. You'll list all memberships that you have, especially those that are simulation related. Those are very good. Your NASCO, your ASPE. If you have one with SSH, you will get a discount when taking your test. Let's see, your local simulation council organizations are very good. We have a local council here in North Carolina. We also have a overarching council as well. Professional experience in simulation. You want to make sure you really, really speak to your experience that you've had over the last 3 to 4 years. That is very, very critical. And usually for most of us, we're in academia, so your CV speaks very highly. It speaks strong to that. So you pretty much can copy and paste your simulation experience from your CV in that area, educational history, all of your undergraduate and any graduate courses that you've taken, employment history, continuing ed over the last 3 to 4 years. Again, you will need to try to have your certificates. And when you go to list the continuing ed, there's categories that you will put it in, and each one you will list, and you'll have to put just a small 2 to 3 sentences or 3 sentences on what that continuing education event was about. So I hope you've kept some of those. If not, sometime you can go back online and Google the event and you'll be able to pull some of that information. But I do encourage you to keep your certificates or keep a brochure. If you present it, pull the agenda of the workshop that had your name in there saying that you was presenting. Because some workshops, especially some that are virtual, some webinars, they may question. And it's not to say it wasn't a good webinar, but just may need a little more information. So if you put anything in there that they just have a slight question about, you will get audited. And the audit is just a simple, you go back, you pull the information about it and just resubmit. And so you should be able to be in a good place, but you need to really make sure all of your continuing education is all geared towards simulation. Simulation, even if you've gone to a faculty workshop and simulation was just talked about or mentioned, you want to make sure all of your webinars, all of your they have on Caserna, there is a Pamela Jeffries has a simulation educator, very, very good. And you could get a certificate for that. That's very good at how they highlight all of the tenets of simulation for people that are new. It's a really good, and it has quizzes with it. So those type things, you really want to make sure any in-services that all lead to you stating and showing that you are a expert in your area, that you've been trained to this point to take the test. Any vendor events that you've gone to learn about your simulators, you want to put that in there as well, because all of that, makes you a very qualified candidate. Your simulation experience narratives, short statements, you don't have to have like a whole page, but just a nice little brief statements about your simulation experience, your professional references. I do encourage you to solicit those references from your colleagues that have worked alongside you or know about your simulation experience, because they will be able to really speak to that in their references for you. And you need 3. If I'm not mistaken, it's 3. Your accommodations, if any, hold harmless statement, confidentiality attestation, and your payment. Here it is about your professional references. Here, there'll be a link, and you actually put their email in, and the forms return directly to the certificate council to perfect confidentiality of the reporter. They will be email a link to the reference form. And I, as always, like if you're getting someone to submit something for you as an employee, you always give them a highlight. Hey, I'm applying for the CHSE and I'm going to submit your email for a reference. So be on the lookout. You'll be able to go back in the portal once you create an account. They even check up on your references just to make sure everybody's submitting everything. Here's a nice guide here that helps you navigate through the application process, but it's pretty straightforward. It'll allow you to go from one section to the next, and you can always go back if you need to, and then a final save and submit at the end. Before you do, they'll actually give you an opportunity to review all of your information submitted. For those of us that are members, and other supporting organizations, again, your NASCO, your ASPE, they are all recognized, and you will get a discount for that. But if not, it would be $4.95. Okay. And if you have any questions, you can also reach out to the coordinator to prepare for your exam. We've talked a little bit about that. I just encourage you to continue to study. There is an exam blueprint, which you already have a copy of. The manual itself is $89. It's a very in detailed manual that have a lot of other questions as well. If you still feel you need more questions that may be a little bit more deeper, it actually goes through each domain. I don't know if you can see this, but it isn't. Once you get it, maybe you can't see it. Once you buy it, it's yours to keep. So it's really, really detailed as well. Has the KSAs attached to it, elements, details of explanation. It's a pretty intense manual that really talks about all the domains of the platform, the test, the CHSE exam. Always also a good one to have as a resource, but once it's yours, you'll have it. I did get that one as well. Also, there are practice questions attached to it once you submit, and then you are made aware that you're able to test. There's practice questions that I did purchase as well. I paid extra to take that exam on the SSH website. And what it really, those questions are in a line with the test platform that you'll be taking your CHSE. So it actually will give you a sample on what that platform will look like. And so I did take that test. It's time, and it was really good for me, also to take that test. And I thought it was helpful as well. There are other SSH CHSE courses. I think, oh my goodness, there's a leadership organization that also um, Sigma Theta Tau that also have some nice resources there, and some of them may be free. So if you are inducted into the Sigma Theta Tau Honor Society, is the leadership society, we have access to some self-helps there as well that can also ready you for the CHSE if you think you need additional resources. Here's the practice exam. It's a 50 practice item, and it really does help you. I know it helped me, and it's a cost for $75. And you can only take it once. And then we still have our resource library here. A lot of these things you have, but feel free to access them as well. Let's see. And then the exam itself it is a timed exam, 2 hours for 115 questions. It has multiple choice. And so again, that's why I'm constantly asking you, why did you choose that answer? You should be able to know exactly why that answer is correct, or be able to say, I know why the other 3 are incorrect. So ask yourself that and challenge yourself as you leave today and continue your preparation to sit for the exam. On the day of, there's different ways you can take that exam. You can actually go to a testing site, or you can do it remotely. Testing sites, they're proctored there, and you usually know that you've passed whenever you finish that exam. You should know that day. Once you pass, you'll be able to use all rights, CHSE at the end of your name, and all those good things that come along with the CHSE. You'll be able to actually attach it as well to your signature page as you use it moving forward. The renewal is for every 3 years, and you'll be able to start again collecting all of your continuing education. A lot of your bigger conferences, your IMSH, International Medical Society Healthcare Simulation, it carries a lot of credits with it. Your NASCO conferences, it carries a lot of weight. So some of your larger conferences, you'll capture a lot of your professional development hours then. But then you have your other webinars. Healthy Simulation has a lot of free webinars that they often send out. That's another one that you can actually sign up to become a member for, and you'll get emails when they have webinars that are going forth that you'll have access to. So that's also some ways that you can actually, when you're presenting, when you're submitting your work for dissemination out into the community, and you get your work accepted to present at conferences, you get weight for that. You get credit for that as well. They want to see that you are, as the expert, taking what you're doing at your institutions and sharing that knowledge out at different platforms. Even if you're developing opportunities to do professional developments within your institution for the other faculty members, you can credit yourself for that too. So there is a section on your renewal form. They'll look for those type expert opportunities that you're taking advantage of to show that you are the expert in how you disseminate your knowledge out to help other STEM educators grow. Any mentorships that you're participating in would be also important to start logging in on your portfolio. Okay. They will send you out a renewal just like it is with your licensure. You will get those reminders letting you know when it's time for you to renew your CHSE certification. Okay. All right. I just wanted to go over that tonight. And I really am hopeful and excited about each one of your journeys. And in my mind, I really do believe, and I've had an opportunity to be with you for the last 6 weeks. And I think you're going to be successful as you continue to study and take that deep dive into some areas. Not that you're just reading the answer to guess, but really knowing the reason why you chose your answer or what in that question really stood out to you. The same techniques we give our students in helping them to take their exams are the same ones we are going to turn around and employ as we take our CHSE exam as well, and as you continue to look at your questions.
The application, once you submit it, is good for 90 days, right?
Once you get accepted, yep, you're good for 90 days. So they send you back your yes, you are approved, you have 90 days to take the exam. And it almost reminds me, like we tell our students, once you graduate, don't wait too long to sit for the boards. The same for us as well. So make sure you position yourself to know that you've got time, that you can dedicate at least another week or so to really take intentionally 1 to 2 hours a day. And I know it sounds hard, but I really had to do that and be very intentional in doing that. Quizzing and looking when it comes down to your theories again, and we'll talk a little bit more about that at the end if we have time to wrap up. Remember, they're not asking you to knowledge questions about your theory, but what does that theory look like when it's rolled out or applied, implemented into simulation? And that's where a lot of your questions are. They're really looking, can we recognize this tenet of that theory? Can we recognize, the principles, evidence-based practices that are either that are active, or they are not active, or they have been breached in some way. Okay. All righty. So that was my spiel with our review of the CHSE exam logistics. We'll try to wrap up at the end and see where we are. And if you have any questions, we'll pull those out at the end. Or if you have any before then, don't hesitate to put your question in the chat box, or you can just raise your hand. We're pretty informal. Okay. All right. Well, let's go ahead. We have 2 quizzes that we're going to go over, and we'll go ahead and start with chapter 22. Chapter 22 is on page 3. Chapter 22 is on page 395. And again, this is looking at operations, management and environment, personnel and non-personnel resources. So we will continue tonight. You will put our answers in the chat, and I'll give everyone a few seconds to put their answer choice in the chat. And then we will just take turns making sure we can understand why we answered that question the way we answered the question. On page 395, question 1, When managing supplies and equipment, it is critical to A, B, C, or D. A, use the same equipment and supplies as utilized in your local hospital clinics. B, track equipment repairs and warranty and service agreement information. C, set up a corporate cooperative with local SIM centers so you can share equipment and supplies. Or D, order capital equipment at the end of the budget cycle. Correct. Our answer choice is B. Our answer choice is B. Correct. Track equipment repairs and warranty and service agreement information. That's looking at us from the manager perspective. How will we manage our supplies? Even if you have a SAMOPS person that's doing that, we have to think with that hat on when we're looking at the questions from this section. So managing those supplies and equipment, it is very critical to track the repairs and your warranties when you look at your answer choices. Okay, so anyone want to share why they chose B or why they did not choose the other options?
I chose it because it costs like $1 bazillion for every piece of equipment, and so maintaining them is super important so that they don't break, and you won't be able to maintain them properly if you don't keep track of when and how they've been maintained.
And that is one of the most important things for us as simulation experts, those that are looking over that sim center, to make sure we do that. Use the same equipment and supplies as utilized in the local hospitals and clinics. That's not when managing supplies and equipment. It is critical too. It's not critical that we do that, right? C, set up a cooperative with local simulation centers so you can share equipment. That's not critical either. It's a good thing, but it's not critical. And order capital at the end of the budget cycle. We know that's not critical because you want to do it at the beginning when there is money available to actually order your equipment. Let's see what your book says. Setting up a system for tracking equipment repairs and service information is critical to understanding and managing operational costs. Using the same equipment and supplies as those utilized in your local hospital clinics is good for the learner, as this might help with familiarity, but it is not of critical importance. Setting up a cooperative with other simulation centers may be helpful, but not essential to running a simulation center. Capital equipment is very costly and is usually best ordered at the beginning of the budget cycle when there is more or most of the amount of money available. Number 2, a mission statement. What is a mission statement? A, B, C, or D? A, a statement of global plans, goals, the roadmap of Simulation Center. Yes, the correct answer is C, the purpose of the existence of the center. Correct. It's not a 3 to 5 year plan. That is more of your strategic plan. A mission is a statement that describes the purpose of the center. Statement of global plans and goals is usually a vision statement. The roadmap is known as a business plan. And again, comprehensive 3 to 5 year plan is a strategic plan. Now, I can see a question like this, even talking about when is this considered when you're looking at your NASCO standards? When is this even talked about? The mission of the program. At what phase in that planning is it talked about? And that's usually in your initial, right? In your initial planning. So you can see that, and it talks about the mission of the program itself. Number 3, recommended policies and procedures for a simulation center include A, B, C, or D. That's correct. That is totally correct. C, your mission, your policies, your recommended policies and procedures, and these are pretty standard. You do need video retention. How long are we going to retain those videos that we're using of our students? And the students need to be aware of that from day one. when you're bringing them into your sim centers, they need to at least sign a document, first of all, giving permission to take videos and be recorded. So they need to know how long they're going to use those videos. Are you going to archive any? And you also need to know the reason, right? They're being used and how can these videos be accessed. Policies and procedures, mission vision, no, collection of prepackaged scenarios with debrief guides and checklists. No, income and expense reports and marketing plans. When we think about policies and procedures, you're looking out of your choices. You're looking at how you are housing your videos that you're doing of your students, of the simulation themselves. And they have a right to say, hey, I don't want to be recorded. And we have to make sure we take good note of those. Remember the question we had where a student was riding along the road and saw their picture on the billboard and they did not give permission? That will really get us in some serious trouble inside of our centers. How to retain and store materials that are vital to the history and functioning of the SIM Center should be guided by policies and procedures. Those policies and procedures should be shared in your department so that all are aware. A collection of the prepackaged scenarios with debrief guides and checklists are considered teaching resources, not policies or procedures. Mission, vision, value statements are usually part of the business plan. There may be policy and procedures regarding the format and the content and the frequency of income, expense reports, and marketing plans, but the actual reports themselves are all outside of a policy and procedure. Depreciation. Depreciation is the part of A, B, C, or D. Depreciation, question number 4. Correct, C. Anybody want to talk about that one? That one's pretty straightforward. That's a nice little knowledge. It is the sudden loss in value of a piece of equipment. Yeah. I wanted to go back to the question we just did, looking at that one in our CHSE format. We would probably see that as well as a situation, right? A case scenario. And one of the things we'd have to make sure we do is make sure we have policies and procedures in place for videography or those things that they're asking for in that case scenario. Number 4C is the correct answer. That's a knowledge. Depreciation is used in accounting to help describe the impact of wear and tear and loss of the value of an asset, such as piece of equipment over time. Capital equipment is usually set up on depreciation scale where the initial purchase price and expected lifetime of the asset are used to decrease in value of the equipment over time. Capital equipment is commonly the budget that refers to capital equipment. Depreciation refers to a planned and calculated loss of value, not a sudden loss. Depreciation is used for durable equipment, not consumable supplies and inventory loss. Durable equipment being your simulators, your high-end equipment, et cetera, and not your consumable supplies. And the Defining Excellence in Simulation program has nice chapters on management of your sim centers. Another number 5, purchasing an extended warranty on a high fidelity patient simulator is an example of A, B, C, or D: risk transference, risk acceptance, risk mitigation, or a positive risk. That is correct. A is your correct answer. Again, that's a nice knowledge question as well. The risk of high costs of repairing and replacing your HPSs is transferred to the company that offered an extended warranty on the HPS. The risk acceptance would be accepting the risk and not doing any intervention, not purchasing an extended warranty, and accepting the HPS as the company offers it. An example of mitigating risks might include doing extensive testing on the HPS to identify any weaknesses and to try and detect any issues in the HPS prior to expiration and of the initial warranty. A positive risk might be an influx of new clients because your center purchased a new HPS. Number 6, the stakeholders ask the sim educator, how did you make that simulation, how to make the simulation real? What should the simulation educator tell them about the most important to increase in realism and learner engagement in a simulation? What is the most important? We're on question number 6. Okay, let's see. Yep, it's B. It is B. And you know that one could be tricky because we'd probably be more inclined to say put the SP in there, but you got to have a willingness of the learners first, right? They got to be willing to be engaged in the process. That's what's going. That's when we do our what? Fiction contracts. So we can dismiss what? What's the purpose of your fiction contracts? That we do at the start during our pre-briefing.
To suspend reality and treat the situation like as if it was real.
Exactly. So we have to really engage them and get buy-in at the start of our simulation through our fiction contracts. We get that willingness for them to engage. Guess what? Realism is already. We can probably go to the sky and back. But you can really have them once you get that buy-in. Having the SP, yeah, is the highest form of realism, but you got to have that learner to have some buy-in, and that's achieved with your fiction contracts. Okay. Realistic smells, sounds, and images, they're all good. High fidelity patient simulators, all good with voice modulators, but none of them are important. None of them will achieve the realism, that the level of realism we desire if the learners are not, engaged, don't have any buy-in. And really know, hey, we need you to come into the sim lab treating this as a real situation. Highlighting those things that need to be simulated versus those things that are real time. Confederate smells, sounds, images, and high fidelity simulators are all beneficial, but unless the learner is willing to suspend disbelief, these other environmental enhancements will be of limited benefit. Okay, when setting up your room for a scenario, the simulation educator noticed a piece of equipment is not working correctly. Select the item with the best sequence for troubleshooting and correcting this problem. This question always get a little controversy whenever we do this one in our course.
I initially picked the wrong answer.
Huh?
I picked the wrong answer for sure at first.
And this one this is one of the ones in this book that I kind of can challenge as well. And I can see why we would have picked the wrong one because I see it. But again, we're looking at what they're really trying to get us at. So I would love to let's talk about this one just a little bit. When setting up the room, the simulation educator knows a piece of equipment is not working properly. Select the item with the best sequence for troubleshooting and correcting the problem. So
this really reminds me of like your textbook answer versus a real life answer.
exactly, there you go.
Like we
Yes,
tell our
there you go.
students, we're in NCLEX world over here. We're in real life nursing world over here.
Yeah, there you go. And see, that's what we have to be in that mindset when we go to take that CHSE because it is the same type. And the authors of this book are all CHSE experts, and so it's just I think the different thought as well. But I can see how B is correct, but it says we definitely know A is not correct. Call the salesperson, representative, manufacturer helpline, ensure the device is plugged in. We know that's not correct. If there's a problem, the first thing you want to do is make sure all connections are secure, because if your mannequin is not operating, you want to go first and at least make sure he's plugged in because sometimes he can become unplugged, right? Sometimes they're looking on the monitor and the pulse ox is not showing on the monitor. We need to go and make sure it hadn't slid off the patient's finger, right? Make sure all your connections are secure. Shut the device down and start it back up again because sometimes it may just need a soft reset. It's a computer. Refer to the owner's manual for troubleshooting and call the representative or the manufacturer helpline. That's us showing that we've walked through all the troubleshooting principles, steps of. Okay. In the back of the book, it said B was the answer. It says refer to the owner's manual for troubleshooting. Check to see whether the device is plugged in, charged. Ensure all cable connections are secure. Shut down the device and start it back up again, and then call the sales rep. I could see that one as well. What they did, they started off with, I got a problem. I'm going to go to the manual. If you mid simulation and that happens, and see, that's when I have to take my mind out. What am I doing versus what they're wanting me to do? I'm not going to pull the manual. The first thing I'm going to go around there and make sure the mannequin's plugged in, or make sure they have on their pulse oximeter. Am I making sense? But check that manual, because the manual may tell you these same troubleshooting things, and then you'll follow suit. The manual says unplug up first, check the plugs. Then the manual says, if everything's plugged in, make sure all cables are secure. Then it tells you to shut it down. The manual says after you've done all these things, now we need to call the sales rep because our mannequin is still not working. So this is a classic one, okay? So don't let them trip you up if you see something similar, okay? Anybody have any more feedback about that one? That's good, huh? It says the best initial step to take is to check all cords, electrical plugs to ensure the connections are secure. Many problems may be corrected by doing this first. Next, shut it down, then restart the HPS, consult the troubleshooting section of the user manual, last call to sales rep. These steps are recommended in this sequence from the most probable and easiest and quickest to fix the most time-consuming and resource-intensive. Some centers find it helpful to put the troubleshooting checklist on or near the piece of equipment so that it can be readily referred to. A novice is going to call first. Some of them are going to call because they, maybe just really, really nervous. But as we are testing and going towards our expert, we're going to follow this sequence. 8, during a simulation is noted that some of the...
Is it my question? So the rationale describes C, but...
It did. But when you look in your book, it kind of, you could see where it's asking us to go and actually go and look at your manual. And that's the quality of, when you think about,
troubles.
I'm sorry.
It's on page 392, troubleshooting equipment, general information, dealing with technology, troubleshooting, same standard steps, ensure all cables, connections are secured, ensure the device is plugged, shut down device, start it back up, refer to the owner's manual, call the rep, repair or replace defective items. So is C the right answer?
Yeah, but they have B as the answer 7. Do you see it says B?
Yes.
Yeah, but what's underneath it describes C.
Yes, it describes C. And that's the one that I was telling you is correct. You want to, but they also, in some sense, to tell you to refer to your manual. But in our book, it's telling us as an expert, we're going to check. I'm going to go to my cords first. And that's what I do in real practice. I go check all connections first.
So we would put a question mark on it?
No, I wouldn't put a question mark. I would follow suit. I would make sure I check my cables.
Okay.
Because
and that's what's on page
middle of a
392.
simulation, if that happens in a sim, you really don't always have time to go and pull up a manual.
Yeah, so the rationale is
going to go to the manual first. If this is a novice person, they're going to go to the manual because they don't really know how to troubleshoot like that. You're a novice simulation educator, but we as experts know we're going to go and check our connectors and make sure that pulse ox is on the finger. Make sure that the mannequin is plugged in. If you can run your mannequins while being plugged in, a lot of them you shouldn't run, just depending on vendor recommendations while you're doing your simulations.
All right, but on page 392, it's the verbiage is exact same as the rationale. So for C, so
that's exactly right, Leroy. But they
all
put
right.
B, so B.
Yes.
You scratch your B out and put a C.
All right, that's what I want to know. Thank you.
Yes, sir. Human. Everybody,
Yeah.
That's again, we have to know our rationales as well. Number 8, doing a simulation. Thank you. That was very good. During a simulation, it is noted that some of the requested supplies and equipment are not in the room and available for learner use as expected. What is the best initial step to take toward addressing this issue? Again, the best initial step. A, B, C, or D? The best initial step. Mm-hmm. Correct. The best initial step would be B. Someone want to talk about? Let's talk about that. During the sim, you note that some of the requested supplies are not there. Some of the equipment is not in the room and available for the learner to use as expected. So what is the best initial step to take? So why did we choose B?
My rationale would be to eliminate distractions for the learner, because you want to make sure the simulation runs smooth and not something that went wrong that wasn't planned kind of thing, because that would distract from the learner, basically. That's my rationale.
That's your rationale, and keep on talking, because what can you use that moment as? Does this reflect real life? What could happen in a real situation in our hospitals? And we're teaching our students, is this somewhere we can still save the sim and get them to their expected end of the outcomes?
Yeah, by calling for a supply
There
or
you
what
go.
have you.
You're
Yeah.
able, exactly. So using unexpected events as much as possible to help them meet the learning objectives. Now, if it was going to take them too far off and we couldn't, then that would be something we would have to consider. But that's not what it says. So don't read into your questions either. So that's great. Thank you, Leroy. Great.
Is that
Could-
termed a lifesaver then? That scenario?
Lifesaver would be say, hey, um, students are trying to, your patient has pneumonia and has crackles.
Right.
And SpO2 is decreasing, and students are not catching it. So a lifesaver would be, hey, we would probably have that mannequin. I can life save through the mannequin, have him start coughing, even start saying, I'm very short of breath, it's hard to breathe. And that would be your lifesaver to try to save. And hopefully that's giving them some cues that they can start looking at the monitor, or at least put the stethoscope on the chest to check the lung sounds.
Okay, I got it. Okay.
So B is your answer. Continue the simulation with the STS, introducing the supplies and equipment into the scenario state. These supplies have just arrived in central supply for this patient. Don't stop the simulation. I love what Leroy said. Continue the sim, observing the learners, adapt to, and then stop the sim and begin to debrief. A good way to circle this back to true reality of the healthcare practices. If it happened in real practice, what would you do? Okay. Using outside lifesavers, such as have the STS introduce the supplies in the scenario in somewhat realistic manner, can help the simulation scenario progress and stay on target with the scenario objectives. Keep your focus on the learners and the scenario objectives. You remember, that's what our whole goal is whenever we're doing our sims and when we're making interruptions. If that simulation becomes unsafe for the students, someone breaks out, they start screaming or they start crying and they fall out in the floor, and it becomes very unsafe, then that is we need to stop the sim. But if we're able to save that sim and still get those students to the end of their learning objectives, we want to try to do that within the time frame that we have. Keep your focus on the learners and the scenario objectives, stopping the simulation and asking the STS why the supplies are not available, and then restarting the sim once the proper supplies have been obtained. Can break again our suspension of reality. Remember, we want them to stay in the spirit of the simulation, stay in the spirit of hospitals, stay in the spirit of clinics, stay in the spirit of whatever that simulation scenario environment is, and to help them students continue to reach their goals. Because once we interrupt that, we have to start all. We've lost them. We probably would just go ahead and call our sim. Maintain realism. Doing a simulation for best learning outcomes. Stick to the scenario objectives. That's a biggie. You may see that more than one time, but just in different ways. Complete the simulation event first and then go back and resolve the issues related to why the supplies were not there. The response to continue the simulation of observing how the learners adapt to the lack of supplies and equipment is not correct because this would change the scenario objectives. It is best to stay with your objectives. Lastly, it's never appropriate to stop the sim and begin the debrief by explaining to the participants that this is a common occurrence and that they are unfortunate victims of a poorly managed center. This would be poor response as marginalizing other team members and it is inappropriate. Issues of this nature should be dealt with privately and not in front of the learners. Number 9, during a simulation, the Wi-Fi connection to the baby HPS is lost and the baby becomes unresponsive. The learners believe that the baby has gone into cardiac arrest and began CPR. As a facilitator, what is the best initial course of action? Okay. Leroy, you want to tell us why you chose B?
Thing.
Why?
Why?
Mhm.
You want to do everything possible to not interrupt or stop the simulation. And if the Wi-Fi ends and I guess they're in asystole or what have you, then and the learner starts CPR, it states in there learning outcomes can be met with evolving scenarios. So in other words, it was a fluke or it wasn't planned in the scenario, but the learning objective was met. So
You can still achieve it, but you don't want to break it if you're able to achieve it. If you can't, then we would, right?
correct.
Mm-hmm.
And then if you stop the simulation and it takes too long, then you've lost the effects of reality and of the I don't know, the environment of the simulation. I don't know how to word that, but
And then D, it says announce to the students. Why would D be incorrect? Again, it kind of circles back to what you said originally.
yeah, because they don't need to know this. The Wi-Fi is out. The learner just needs to know the patient doesn't have patient doesn't have a pulse or requires CPR. So, and that would take away again from the reality of the simulation also. So
Mm-hmm.
that's, I don't know, that's what I'm thinking.
Mm-hmm. Anybody else want to chime in?
It stays, and D says modify the objectives. You don't want to modify objectives.
Mm-hmm. Mm-hmm. If the learning objectives can be met, again, guess what? Then the evolving scenario is a good solution to this challenge. Stopping the sim and attempting to reestablish the Wi-Fi connection while you give the learners a break may waste valuable time and interrupt again suspension of reality that the learners have established. Stopping the sim and debriefing the scenario based on the objectives the learners have met will result in incomplete learning. Announcing to the students that the Wi-Fi connection was lost again and to continue the sim with modified objectives is not desirable and this will not meet the initial learning objectives. Number 10, a recently purchased high fidelity HPS does not function as intended for the third time this week. Each time this occurs, the HPS is turned off and then restarted, after which it begins to work properly. What action should be taken? A, B, C, or D? The third time this week. Third time in 1 week. Yes, you are correct. The answer is D. Because it's the third time in this week, we need to go ahead and call our representative. Report the problem and work with the company for resolution, determining that this is a normal challenge when working this HPS and not reporting the problem and only documenting it in your HPS equipment logbook is helpful for historical data, but will not resolve the issue. Simply documenting incidents will not bring the problem towards a resolution. Reporting the problem early can help resolve this, although you may feel justified in reporting your problems and frustration on Facebook. This will not resolve the issue with our HBS. Again, there's a nice section in our Pallegana's book. There are also some articles out there too that I found very helpful regarding lifesavers as well. That would be good to take a nice little deep dive in to kind of look at your different ways that lifesavers can be used inside of your sim center or your simulation to get your students on path to achieving their learning objectives. Okay. We're going to go on to chapter 23, accreditation and simulation labs and simulation standards on page 411. This one is really going to look at our NASCA standards a lot. Those articles are very good. 1, which statement is true about the standard of pre-briefing, preparing, and briefing? A, B, C, or D? How well do we know our standards of best practice according to NASCA? You are correct. It is D. It is D. Pre-briefing and preparation and briefing is a time where we develop the purpose, the learning objectives of the simulation experience. C is wrong because it says all. A, sole purpose. Again, look at those keywords. B, this standard describes facilitation methods and presents the key qualities of an effective facilitator. D is our correct answer. Is doing that pre-briefing time or briefing that we develop. We do our fiction contract. We do our agenda, timeframes, equipment, learning objectives, establishing that psychological safe environment for our students, the outcomes. All of that is in our pre-briefing. The pre-briefing should be at the correct level, making sure it's at the level of your learners. That simulation objectives are aligned. Learning objectives are not the sole purpose of pre-briefing, and the facilitator effectiveness is not judged. Being judged in pre-briefing does not include the infrastructure. 2, the blank prepares activities and pre-briefings prior to simulation-based experience and also deliver cues aimed to assist participants in achieving expected outcomes. Correct. Your answer is C. It is the facilitator that prepare the activities and pre-briefing. It is the facilitator is that person. Pre-briefing, preparing activities, pre-briefing to assist the students in achieving the learning outcomes. Project managers or directors have a larger role and oversee sim labs, information technology. Technologists assist with computerization of the sim lab. Okay, again, that's in our pre-briefing briefing, looking at the roles of the people in the simulation itself. 3, simulation educators developing a safe self-study report for an accreditation process and is describing the simulation about the goals and responsibilities of a rapid response team. This should be integrated in which of the following standards? Where do we find? Is it in evaluation of learner performance, the debriefing process, facilitation, or the outcomes and objectives? You're correct. It is D. D is our correct. That's where we would find that housed in our outcomes and objectives. Outcome objectives include defining the goals and objectives or outcomes of the SIM scenarios as they are being planned. Evaluation of learners is either what, formative or summative. Evaluation methods. Debriefing is the reflective learning part of our simulation experience that takes place after the simulation experience, while facilitation has to do with the program outcomes. End of the semester competency checkout off using a standardized patient as an example of what type of assessment. We got a nice knowledge question here. A, B, C, or D. It is B, that is summative. At the end, pass, fail is the final grade or experience of a course. Formative evaluation done while the learners are experiencing competencies to improve. This is also true for midterm or midpoint assessments. Self-assessments is reflective process that promotes self-improvement. Okay, let's look at this. What standard emphasizes the need for gap analysis? Gap analysis assessments, as well as encourages the continual learning development of the simulus. Which standard looks at the continued development of this? It is C. That is our professional development. Okay, that one's pretty straightforward as well. Number C, a key ingredient for a successful accreditation process is to have a SIM educator, accreditation liaison, consultant, or project manager. A. So correct. Yes, that's the important person on your team. If you're looking for accreditation, all of those others are good, but you want to have that simulation educator. That's critical to your accreditations. 7, a simulation educator's development a self-study report for accreditation and includes a section on personnel qualifications. This information should be included in A, B, C, or D. Professional integrity, debriefing, simulation design, or facilitation. Personnel qualifications. Where should we find that when we're looking at our standards? That's the correct. It's in your facilitation. Yep, you are correct. You are correct. Correct. Facilitation includes personnel qualifications and continuous professional improvement. What do they need? Professional integrity has to do with your ethical issues, your ethical practices, your ethical decisions, what is ethical when thinking about our simulations. And debriefing, again, is your reflective process of the simulation designed to do with the development of the simulation scenario and reflective learning. All SIM specialists should be educating students with facilitation methodology. Looking at D, this one is asking for the most appropriate organization, and this is a straightforward one too. I believe we saw something similar during the accreditation process. The applicant needs consultation about the learning domains. The most appropriate organization to contact is SSH, and NASCO, the Board of Nursing, or the National League for Nursing. We're thinking about our accreditation standards and getting clarification for that. Is it SSH and NASCO, your local National Board of Nursing, or the National League of Nursing? When we're thinking about overarching accreditation, that will be your SSH, because they're the ones that are accrediting your centers. NASCO is putting out your standards of best practice, and they do have the endorsement. Your National Board of Nursing is looking at your board scores, right? And some have some, but ours don't have a whole lot to deal with. They just tell us how much percentages we can use. And then your National League for Nursing is another hub as well that actually looks at research and how we facilitate practices in the simulation. Number 9, best practice is a method that has been generally accepted as superior to any alternatives because it produces results that are supported by research. Which standard incorporates best practices for adult learners. Best practice for adult learners. Is it the debriefing process of outcomes objective or the simulation design of facilitation or simulation design? A, B, C, or D? Yes, correct. Your answer is C. That's where we will find alternative best practices. It's the facilitation is the best simulation teaching practice that makes learning experience as rich as possible and to meet the student learning outcomes. Debriefing is important, but facilitation is also used in debriefing. Outcomes and objectives are made prior to the teaching process, as is the sim design. And our last one before we take our first break is the duration of Sim Center accreditation. The entire Sim Center being accredited is 1 year, 3 year, 5 years, or 8. It's correct. It is 5 years. Okay. All right. It is 7:07. We'll go ahead and take our first 15-minute break. And then when we come back, now we'll go ahead and we'll do our quiz in the back of our book, questions 1 through 24. So get you a nice break, get up and walk around as you usually do. And then we'll come back and then I'll give you about 25 minutes to take the quiz. And then we will have another break and then we'll go over our rationales. Okay. Good to see you, Krista. Glad you made it home safe. Okay. Let me pause. Okay, we are back. Hope everybody's had a great break. We will go ahead and turn to page 417, which is a practice test, chapter 24. Okay. And we will get started. It's 7:22. We'll have 25 minutes. Probably give you till 7:50, give you that extra minute there to complete your 25 questions, okay? All right. I'm gonna go ahead and set the timer on my end, and we will go ahead and get started. Questions 1 through 25, starting on page 417. And you can cut your camera off, and when you're done, you can cut it back on. All right, time is up. We're at our 7:50 mark. Hope everybody was able to finish. Were we able to finish the 25 questions? Thumbs up, thumbs down? Good, 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 good. Okay. We can either take a 15-minute break now, or we can move forward to go over our rationales. So I'm all in favor of what you want to do, what would be best for everybody. I'm okay.
Keep on keeping on.
Keep it on, keep it on. Well, let's roll. All right. So we are question 1. What is the best simulation modality to promote changes in the learner behavior in the affective domain? A, B, C, or D? Yep. Okay. A is our correct answer. And what are 3 learning domains? Right quick. What are your 3 learning domains right quick?
Cognitive, affective, and I always get this mixed up. Psychomotor. Yeah.
Exactly. Skills. Putting that Foley in, doing that IV, psychomotor, skills. Awesome, awesome, awesome. And affective, your simulated patients are your best fit for that because they can respond real time and emotionally. They can provide that feedback. Simulated patients, participants will provide the learner with a human that can assist with them with reflecting on how they made a patient feel during their interaction. Part task trainers, high fidelity mannequins, and VR cannot replace humanness for affective behavior. Great. Number 2, when considering psychological fidelity, what is the most important to consider? A, B, C, or D? Certified SIM educators, learner-centric approaches, learner outcomes to guide the SIM, or high fidelity simulators. Correct. Our answer is C. Correct. Always our learning outcomes guide the simulation. That's the most important. Yep. Having a planned simulation learning experience with learning objectives to guide the simulation is important and maintains what? Psychological fidelity. Learner-centric approach are also important, but do not guarantee that the scenario or learning activity will be psychologically sound for all learners. Neither does having a certified simulation educator or high fidelity simulator do the same. And remember, those objectives are learner level to the learner, the sim itself. Number 3, which simulated participant attributes need to be considered for realism? A, B, C, or D? Hair and skin color, ethnicity, education level, race and articulation, or age and gender? I love it. D. D is our correct answer. Why is age and gender out of our choices needed for realism? How does age and gender help us with realism? Or give me an
Because
example.
you would treat children differently than adults, medications, things like that, and it would take away from the realism of having a adult but pretend they're a child.
That's right. That's right. If it's a pediatric simulation, you need to have a pediatric actor, pediatric mannequin, not an adult mannequin trying to be a pediatric. It interferes with our realism. Congruency. Learners are assisted if age and person identified gender are congruent with the simulation scenario. This will increase realism more than hair, skin color, ethnicity, race, articulation, or education level. Number 4, the new simulation educator needs a better understanding of the simulation techniques. When they state that, according to NLN, Jeffrey's simulation theory, the following component of simulation is important. A, B, C, or D? D, that's correct. D is our correct answer. Educational strategy, participants, and simulation experiences are a part of her. But when we look at specific pre-brief times, Brief and brief should not have specific or strict times to be completed. Each group of the participants may have different learning needs. There needs to be an experience, educational strategy, and participants or learners. However, when you think about setting up your agenda, we do add times to the simulation agenda just to kind of keep our simulation structured. When you're thinking about the NL and Jeffrey simulation, those focuses are A, B, and C. Number 5, a simulation researcher would like to investigate Kirkpatrick's levels of evaluation and would like to focus on levels that need more evidence. Therefore, the simulation researcher should choose to study A, B, C, or D. I love it. Yep, level C. Level C, looking at the behavior that's changed, and then L4 results. Those are the areas that we need a little bit more reaction. What's your response? What went well? Number 2, what did you learn? B, with acting clinical, looking at that behavior, and of course, results, patient outcomes need a little bit more research. So C is your correct. How simulation changes behavior and produces results that benefit quality patient care are areas still in need of additional evidence. These are studies about learning and the reaction in the literature. Okay, awesome. We're looking good. Number 6, simulation educator understands education and learning in simulation when they stay using a simulation video in what manner? A, B, C, or D. Show the entire video without comments. Do bookmarking while videoing and show critical points. Correct. Our answer is B. That's the best way to use your video, having that able to do the bookmarking, critical points, because when you go to do your debriefing or providing student feedback, you'll have those key areas already highlighted. Showing the video's important critical points, both positive and negative, more effective when showing the entire video. Just showing negative implementations or letting the learners watch on their own will not provide the behavior changes or the educational experience that we are aiming for. Number 7, a novice simulation educator needs a better understanding of simulation research efforts when they state A, gold standard for debriefing processes is needed. B, learner satisfaction with simulation pedagogy is understudied. Impact of participants' race on simulation outcomes is understudied. Or D. Yep, your correct answer is B. That's the area it has been studied. Pedagogy. Learner's perception of SIM is one area that has been studied. Debriefing process of learner satisfaction with SIM pedagogy and the impact of participants' race are in need of further investigation and data to determine best practices. Number 8, from national survey, what is the rationale clinical to simulation time? A, B, C, or D? Correct. 1 to 2.
This really irritated me. I know we always talk, it's 2 to 1, right? And the way the question is worded in that order, how many hours for it lists it in the opposite way. And so I answered it the opposite way, matching the question. There is not a question like that on the test. That would really
I don't remember that per se, like because to me that would be a straightforward, and I don't remember that.
Chris, I think we all fell for that one.
Right, clinical to simulation time, which means clinical should be first and then simulation time, right?
Right.
Isn't that how our ratio works? Anyway, okay. I'm done now.
Yep. Nope, I got you. Number 9, the simulation educator did a literature search and found that most published data pertain to which of the following levels of Kirkpatrick's. Again, Kirkpatrick's, you need to know Kirkpatrick. Tell you, read him a lot. Okay. All right. Yes. 100% A, reaction. We have the most published data in the evaluation process is our reaction. How is they responding to the what went well? How are you responding to the sim? How are you feeling? The second most research area is learning and behavior changes, but we need more research, of course, in outcomes results. Number 10, a novice simulation educator needs better understanding of simulation learning when they indicate that they plan to use which of the following modalities for a mental health simulation. That's correct. C, I'm serious. Mental health, emotional, right? Part task trainer, virtual game, yes. High fidelity, yes, because we can actually have that high fidelity patient respond. A simulated patient, most definitely, but a part task trainer, you use those mainly for what type of learning domain?
Which part
Which
task
one,
training?
Leroy? I know you. Which one are we going to use our part task trainers
Psych-
for?
Psychomotor.
That's
Yeah.
exactly right. Whoop, whoop. That's exactly right. We're going to use that task trainer to put that Foley in. We're going to use that task trainer to do IV therapy. Going to use that task trainer to do your NG tubes, psychomotor skills. Your blood pressure arm to do those blood pressures. Exactly. That's what you're going to use that part task trainer. All the rest of them can be used. Psych mental health, looking at that affective domain. I love it. Number 10. Yes, yes, yes. It's probably the least effective modality when you looked at your choices, the part task trainer for a affective simulation. I could see that one. Better choice would be the simulated patient because they could display the mental health issue. High fidelity may be used with the controller. And the use of audio, but it's still not as effective as your SP. Who demonstrates emotion, virtual gaming will also lack that emotional need. All right. Number 11, a novice simulation educator needs further education when they state a debriefing technique, a debriefing framework is A, B, C, or D. Correct. Whoop.
This one got me too.
This one, because we really, to be honest, we don't use this, at least I know I don't, as much when you think about it with the pail. And I had to look an article up on that one, and I may put it in our little resource, but
I hear it, people use DML all the time. I didn't know
uh-huh,
it was not an actual
right,
debriefing
right.
method. Bizarre.
It uses of advocacy and inquiry as a conversational strategy. This one we probably won't see, because that there can be very controversial. But B, when you think about preview advocacy inquiry, it's the use of advocacy inquiry as far as like when you probably would hear it most in a conversational type of as a conversational strategy. But yep, I challenged this one as well. Technique strategy used, housed in the debriefing with good judgment. This can throw you off. It's housed inside of the good judgment. When they state debriefing framework is preview advocacy.
This could be a test question that they're testing. They won't count against our grade.
Debriefing for meaningful learning is, and then it says, yep. That one is a one we've challenged.
Yeah.
Number 12, the organization that maintains healthcare simulation standards of best practice is, we just saw that one. I know everybody's going to get that one correct. If you see that one, that's just oh yes, that's one. That's the one that rip it out. But yeah. We've talked about that one. Number 13, a simulation educator receives accommodation, an accommodation letter from the university's disability office that states the student has an accommodation, which is a special stethoscope for people with hearing impairment. The simulation educator should A, B, C, or D. Talking about accommodations with our students. That's correct. You let the student use the stethoscope. We have to abide by those accommodations, right? Let them use the stethoscope. Developing a scenario with a stethoscope that's not needed, is not necessary. As the simulation educator, we should not interfere with the student using it, and you don't want to bring attention to it. The student should not be assigned another role since they are learners, and calling out the student in a briefing definitely is not appropriate. 14, simulation educator needs to set up the lab for advanced healthcare learners to practice central line insertion. The best modality to practice this skill would be, and why would a part-task trainer be the best modality? Because part-task trainers are excellent for what?
Skilled.
Exactly. Skills.
And
Looking at psychomotor and skills, exactly.
if you rather have more wear and tear on the part-task trainer than your the high fidelity mannequin.
Yep, exactly. You're not gonna want to put it in a simulated patient. They ain't having it. A high fidelity mannequin, you'll tear them up, especially when you all the electronics. It's just too expensive, and the virtual reality. So part-task training is your best choice. 15, a simulation educator is debriefing a group of junior learners and properly focuses the discussion by stating, I think the best start is to review the entire scenario. B, you work well as a team. C, let's take a vote to see what the best part of the experience was. And D, we can discuss how we would do that the next time. And our answer is
15.
exactly. D is really defines what? Debriefing is what? A time of what? When we think about debriefing, it is a time of
Reflection.
exactly reflective learning. And D really states that, right? We discuss how we do what we would do the next time. We did this, but we're going to do this. So reflecting on that behavior promotes self-reflection. So that is our correct answer. Let's see what it says here. Purpose of debriefing is process improvement. There's only a need to review important parts, not review the entire scenario. The learner should reflect on their team effort. The best part of the experience may be different for different learners. 16, a simulation consultant was hired by a healthcare academic unit to assist with developing a simulation program. The best advice would include A, B, C, or D. Scheduling sim at a specific time during each semester. Correct. Our answer is D. Integrating that sim throughout the curriculum. Integrating simulation throughout the curriculum. Integration of it throughout the curriculum. Simulation experience should be integrated. It does not have to be a specific time, and all students should have the experience as a learning tool rather than just a remediation methodology. Number 17, a novice simulation educator has new video equipment capabilities and would like to use the video equipment. The seasoned simulation educator looks at the upcoming laboratory schedule and suggests A, interviewing a patient, megacode and advanced cardiac life support, C, medication administration, or D, intraosseous vascular insertion. What would be best for this novice? Correct, the interview with the SP. Yes, that would be the best for this novice simulation. All the others are good for your expert simulation educators. Because they can video and have the learner rewatch and reflect. The other three concentrate on skills and actions that can be recorded by other methods. Interpersonal interactions are captured well on a video, and that's what we would get from that SP. 18, a simulation consultant is using Kern's method of curriculum integration and is therefore expecting to begin the curriculum change by first doing what? It didn't say first, so let me take that back. Begin the curriculum change by performing a needs assessment, undertaking a learner's assessment, choosing the appropriate environment, establishing learning objectives. Correct. Our answer is A. It starts with that needs assessment. Looking at our NASCA standards. Always start with a needs assessment is the first step to identify the change if needed, and then the gaps in the curriculum that must be addressed. Learner assessments can be added to the needs assessment once the gaps have been established. The environment is entire learning organization, a unit, and the learning objectives should be established when a new curriculum model is decided upon the faculty. Let's do our needs assessment first. 19, the novice simulation educator needs additional understanding when they state the following. Is a protection of students' ethical, legal, and regulatory rights in a simulation laboratory A, B, C, or D. They need a little bit more understanding. Yes, yes, yes. Correct. Our answer is C. They need a little understanding when they say implied consent to record when tapes will be destroyed after debriefing. A, having codes of conduct accessible to students, yes. Maintaining fair evaluation process throughout the learning activities, yes. Consent for picture taking for any use, yes. All of those are true when we think about ethical, legal, and regulatory rights in our sim lab. Even if a tape is going to be destroyed, there still should be permission before it's taped. Having codes of conduct accessible to the students, maintaining fair evaluation processes throughout the learning activities, and consent for picture taking for any use are correct things to do. Ethical, ethical, ethical. Which assessment, looking at number 20, which assessment method should the simulation educator use to measure competency attainment? Validated checklist, multiple choice test, peer critique, focus group. Correct. Our answer is A. And what do we know about these validated checklists?
It would, if it's validated, it measures competency.
Mm-hmm.
And
Validated check. I'm sorry, go ahead.
yeah, I'm sorry. It's just the word validated. So if it's validated, it's measuring what it's supposed to measure, which you're using it for competency. So
And they're the good
yeah,
objective method to ensure competence or measure
right.
competency.
Yeah, multiple choice test doesn't make sense to me. But
So
and
let's
then you
measure
would,
something.
and you
Measure
don't want
something.
and you don't want a peer of students checking off other students, I guess, unless I don't know. I guess you could in some ways, but in focus group, I'm not sure about how you would have a focus group in the simulation.
Or using a
But
focus group to assess, right?
right, right,
I could see that one. What are your choices? What would you do in evaluation? Which tool would you use to evaluate? I could see that.
right.
I could see that again. And just really making sure we know how to choose which evaluation tool is appropriate for what we're evaluating.
But again, then the question says, should the simulation educator use and peer critique is not what the
Mm-mm.
facilitator would use. Okay, all right,
Mm-mm.
got it.
And they're each measuring different things or providing different information. But your validated checklist, yes. So if you have that on there, they're trying to decide and see if we know what type of evaluation tools we would choose. Multiple choice testing is better suited for cognitive evaluation. Peer
Okay.
critique is good for feedback, but the learners are not experts. And focus group is good for understanding perceptions, but we're looking at competency attainment in that checklist. Yep. Number 21, studies have consistently demonstrated that simulation is a good learning experience to improve clinical outcomes, teamwork, patient outcomes, and knowledge. Yeah. B, and we think about our team steps. Team steps is where we're looking at. So we need to know all things team steps. What does it look like rolled out? What are the different tenets of team step? We see a case study on our CHSE. We need to be able to know which part of that, which tenet of the team steps they're actually relating to and be able to pick that out. So that's where we're going right here. Teamwork, that's where we use simulation, actually using our team steps to help us improve clinical outcomes, patient outcomes, or knowledge. So team steps is our best answer. Study support SIM as a learning methodology and positively affect teams, teamwork. Most studies are needed long term to understand effects on knowledge retention and clinical and patient outcomes, which we know they're still needing more research to support patient outcomes as well. Number two, interprofessional education is used in simulation as a modality consistent with experiential learning, behaviorism, deliberate practice, self-directed learning. Correct. Experiential learning. Experiential learning. Behaviorism theory. You know what? We're looking at what behaviors being impacted and changed, right? When we're looking at deliberate practice is really good, right? Because you have that student continue to do that Foley, continue to do that insertion, continue, because you're taking them to a place of proficiency, right? And then self-directed learning is what it is. That student is directing their own learning. Okay. Interprofessional education is a form of experiential learning because it encompasses in-person, hands-on learning. Behaviorism is a learning theory that uses reward system. Deliberate practice does not have to encompass IPE. Interprofessional students and IPE is not usually self-directed learning. Interprofessional education, again, we're looking at that, and also teams and how that ties in. 23, the simulation educator wants to improve healthcare learners' skill in central venous catheter placement. The best teaching method to accomplish this is deliberate practice, high fidelity scenario, case scenarios, case studies, or standardized patient encounters. We just kind of just touched on that one too a little bit. Our correct answer is truly deliberate practice. Yes. We're wanting to do that's another skill, right? So having them perfect that deliberate practice would be the best teaching method, having them do that over and over again. High fidelity, no, because you could use a task trainer for that. Case studies or SP encounter, definitely you're not going to put a SP in central venous catheter placement. Deliberate practice is a modality that assists mastery in psychomotor competency. High fidelity mannequins are not needed for tasks. Case studies do not provide the psychomotor skills, and standardized patients cannot be used for invasive procedures. 24, a simulation educator is providing a healthcare learner with a documented formative feedback on interpersonal communication skills. The purpose of this is to A, B, C, or D. Assign a grade. Correct. The answer is C. Yes, provide them some constructive feedback. Correct. Correct. Formative feedback. Forming them along as we are getting them to a place of proficiency to be ready for that summative evaluation. And our final question of the night, during a scenario, the simulation educator programs the mannequin to cough in order to have the learners listen to the longs that they did not complete on the head to toe patient assessment, the technique in which activity element / modality. Which element is this? Correct. It is the interactive element. Not passive, not active, not transference, but it's interactive. Actually, certain that cue during the scenario to get that student learner interactive element. This is not passive active learning, and there's no transference into practice because the students are what? Interacting, they are practicing. Well, I tell you what, you guys made 100 tonight. That was really good. You still have a ton more. You still have more questions in your book, and I do encourage you to continue to work in your book and complete those questions and look at your rationales. Talk to yourself. Why did I choose that answer? Why is it correct? Why are the other choices wrong? What are they asking me in the question? Don't read into it. And please don't look at your CHSE exam through your lenses as you're doing things in our sim world. Everything is not perfect and in order. So please read the question as it's saying. Don't interject anything. I did add an article to your week 6. Sorry. I did add an article, excuse me, to your week 6 folder on lifesavers. I put it in the chat as well. It's an older article, but it's good. It talks about the initiation of lifesavers. Whoa. So everybody good? Well, it looks like we're going to get that time back. I'll give you 5 minutes. Is that okay? I tell you, I have a heart for you. 6 weeks really causes us to connect and be a family. So I'm here for you. Please don't hesitate to email me, okay? And if there's anything I can do moving forward, I'm willing to do that as well. Don't forget to complete your evaluations. We take those evaluations very seriously because it helps us improve our program. And your evaluations can be anonymous, so please don't hesitate to provide that helpful feedback. I wish you well, and I'm confident that all of you will do well. I do encourage you to take that deep dive into the resources and make sure you look at the cross map. Go back over those concepts that just kind of was like, I had to think really hard about that one. If you get a chance to do your self-reflection, I encourage you to take a deep dive on that. And don't forget those other resources that are located on your SSH and ANASCO websites. And don't forget to get your CEU as well for your completing this course. I'm sorry, Leroy.
Will the evaluation be in week 6 folder or?
No, it's actually on the platform itself. When you go back to your podium platform, you'll see the link and be able to click on it then.
All right. Okay.
Hey,
Thank
it's
you.
been great knowing each one of you.
I appreciate all you did for us. So thank you.
Thank you so much. I really have a heart for you, and I mean that. So you be in my thoughts and prayers because I'm gonna be expecting to hear something from you very soon.
Thank you so
Okay.
much.
Keep praying up for us.
I will. I am. I am. I have my family, my husband, and everybody. We call you out. They may not know your names, but they know it's Cohort 4.
Yes.
Thank you.
Yes,
Yes, thank you.
Please let me know, okay?
Yes.
I'm still here for you no matter what. Email me.
All right.
Yeah,
Thank you.
we can jump on a Zoom session too, so don't let that be a barrier. And if you need to call me, we can make that happen as well.
Sounds good. Thank you.
Thank you.
Bye-bye.